guys, good evening. Welcome back to my channel, which is Easy Nursing Notes. So in today's video, I'll be teaching you about management of first stage of labor. So let's get started. So for the management of first stage of labor, first point is encouragement, emotional support to the woman. We have to keep the mother's morale up. So we have to give psychological support to the woman. We have to encourage the woman. Constant supervision is also very important. So constant supervision should be taken place for the mother. Second thing, enema with soap and water or the glycerin suppository should be given if the doctor found that during per-vaginal examination the rectum is overloaded. So we give enema to the mother. Next thing, the patient is allowed to move, allowed to walk if her membranes are intact, because walk encourage descent of head and ambulation can reduce the duration of labor. It can also reduce the need of analgesia and it can improve the maternal efforts. Food is withheld during active labor, but we can give fluid, ice chips, fruit juice. These things can be given to the mother. The patient is encouraged to empty her bladder. If she can go by herself to the washroom, she should be encouraged to empty her bladder. If she cannot go to the washroom, so bedpan should be allowed for her. Bedpan should be provided to her, because if mother will not, if she will not empty her bladder, so the uterine contraction will be inhibited. Next thing, for relieving the pain, the common analgesic, which is pethidine, 50 to 100 mg IM, it can be given to the patient to relieve pain. It is analgesic as well as it's a sedative. If we give pethidine alone, sometimes the patient may feel nauseated or she may vomit out. So another medicine, metoclopramide, is also given along with this pethidine. These are the commonly used analgesic during the labor when the pain is well established. But we have to take care of one thing. If the labor is going to be conducted within 2 hours, so these analgesics should be avoided. They should not be given. Next thing under management of first stage of labor is assessment of the progress of labor and noting the partograph. Partograph should be plotted to assess the progress of labor. Detailed video on partograph you will be able to see in my next vlogs. So here I will not discuss in detail. So knowing the progress of labor is very important. We have to check fetal heart rate. Fetal heart rate, normally it is 110 to 150 per minute. So the fetal heart rate should be checked every half an hourly during the first stage of labor. Next we come to the vaginal examination. Vaginal examination is done to note the dilatation of cervix, to know how much the cervix has been dilated. Generally, when there is full dilatation, so the cervix is dilated up to 10 centimeter. So through PV or the vaginal examination, we check the dilatation of the cervix. Then we do vaginal examination to know the color of the liquor. Color of the liquor if the membrane is ruptured, because sometimes the baby pass meconium or some other color change is there, so that shows the complication. The liquor should be clear, amniotic fluid should be clear if there is no complication. So note color of the liquor is very important. Then vaginal examination is also done to note the station of the fetal head and flexion of the fetal head, descent of the head. All these things we can know only by doing PV, the vaginal examination. Last point of management of first stage of labor is assessment of the maternal condition, which is also very important. So we have to check vitals of the mother. We have to check BP, the temperature, the pulse of the mother every 2 hourly. Then we have also observe tongue of the mother to check for hydration. And urine output is checked, and urine is checked for the presence of acetone and the glucose. So all these points which I have told you comes under management of first stage of labor. So this was all about management of first stage of labor. I hope you understood. If anything is remaining, you can go through the notes which I will be showing you just now. Guys, don't forget to subscribe my channel for the further videos. Good night. Bye bye. Enjoy the notes.